Hi, my name's Dallas Bennett. I'm 25 years old and I grew up in Campbell River on Vancouver Island, and I have cerebral palsy. I graduated with a Bachelor's of Science degree in biotechnology from a joint program between the University of British Columbia and BCIT in 2015. During my undergrad, I participated in a co-op program which allowed me to gain work experience in several different academic labs. I started in Dr. Wolfram Tetzlaff's lab at the Blasson Spinal Cord Center in Vancouver, studying spinal cord injury and aging. Later, I had the opportunity to move to Wilmington, Delaware for 8 months and work in Dr. Robert Aiken's lab at the Nemours A.I. DuPont Hospital for Children. His lab studies cerebral palsy and has found that children with CP have disrupted nerve-muscle interactions evidenced by disorganized neuromuscular junctions. A neuromuscular junction is the site where a nerve communicates with a muscle fiber. Acetylcholine is the chemical that is released by the nerve to interact with receptors on the muscle fiber in order to activate the muscle. Here, the acetylcholine receptors are highlighted in red. Acetylcholine esterase is the enzyme which ends the transmission of the signal, and here it is highlighted in green. When red and green are combined, they merge to form the color yellow. In a normal neuromuscular junction, you would expect to see the entire junction as yellow in the composite image. However, in this example, which is from a patient with cerebral palsy, you can see that some areas are yellow, but other areas are red or green. They found that the degree of this disorganization is associated with the level of functional ability in children with CP. This suggests that nerve-muscle interactions in CP are fundamentally dysregulated, or that neuromuscular junctions in CP patients fail to mature completely. These findings show that CP is more than just a brain injury, as is normally talked about, and since it is a developmental disability, it truly involves the entire body. During my co-op term in this lab, my project involved developing a technique that allows for the use of a microscope to image the entire depth of a neuromuscular junction and create a 3D model, allowing for the disorganization of that neuromuscular junction to be visualized and quantified. In the summer of 2015, I moved across the country to Halifax, Nova Scotia, and started a job as a research technician in Dr. Ying Zhang's lab. Her lab's focus is on the role of a specific type of interneuron in the spinal cord and its role in locomotion. I've also been working closely on a project studying a drug candidate for use in treating amyotrophic lateral sclerosis, or ALS. I'm considering pursuing a master's degree in medical neuroscience at Dalhousie University in the near future. Over the course of my undergraduate degree, I was blessed to receive several Tanabe bursaries from the Cerebral Palsy Association of BC, thanks to the generous funding of the Kinsman Foundation and the Burnaby Lions Club. This money helped me to pay for my textbooks and living expenses over the course of my post-secondary education. Despite my disability, the greatest barrier I faced in my education was actually the cost. So the Tanabe Bursary program truly helped me learn without limits, and I'm so thankful to the CPABC for supporting young people like myself to further their post-secondary education goals and to experience all of what post-secondary has to offer. Thank you so much for listening and supporting this wonderful organization. I hope you have a terrific rest of your evening.